Thank you for joining us. We are super excited to be here to talk about the Affordable Care Act. My name is Maria de la Cruz from the Houston Health Department, and I oversee the Enroll Gulf Coast Collaborative, and I'm here to introduce these wonderful ladies. Melissa?
I'm Melissa McChesney, a policy analyst with the Center for Public Policy Priorities.
I'm Trelina Amos. I'm the Director of Patient Access Outreach for Legacy Community Health Services, and I oversee the in-person assisters for Marketplace Open Enrollment.
And hi, I'm Aurora Harris. I'm the Deputy Director of Partnerships and Organizing at Young Invincibles.
Great. So we're here again to talk about the Affordable Care Act, but there's lots of different names that are out there. So what are some of the names that you all hear about in the community? Start with Trelina.
ACA, Affordable Care Act, is one of them.
Okay.
Obamacare is a big one.
You might also hear Marketplace or Healthcare.gov.
Great. So for the purpose of our conversation today, can we keep it with Marketplace?
Sounds good?
Absolutely.
Sounds good.
So what is the Marketplace? Trelina, can you give me an example of what it is?
So the Marketplace is connected to the lovely website you see behind us, with its Healthcare.gov. This is where individuals can go and shop to find healthcare plans that they might be interested in. If you just imagine yourself at a grocery store with a basket shopping around, you may get your cereal, you may get almond milk like me, or you may go with dairy milk, which I'm allergic to, and you can have these different options, and you can compare the two. Like you would read for calories or ingredients, you would compare the different types of plans that they have there. And it's the safest place for you to go shop.
It's important to shop on the Marketplace, but why should someone enroll?
It's a really good question. So as young people, we're often tasked with whether or not we should add the cost of a health plan into our lives. And I like to think of three big reasons why we should. So the first is peace of mind. You should definitely shop for a health plan just to make sure that you're safe throughout the year. You never know what could happen. The second is financial security. So in case something does happen, a health plan often protects you from really, really large medical debt or medical costs that you wouldn't have had otherwise. And lastly is comprehensive coverage. There are a lot of things that you can get with a health plan that are going to be at no additional cost to you other than your premium. So I would definitely say those are the top three reasons someone should shop.
Absolutely.
Awesome. And we're actually in our 5th year of the Affordable Care Act, or the Marketplace. If I was in the Marketplace last year, doesn't the system automatically re-enroll me into a new plan, Melissa?
So yes, that will happen. So ever since year 2, we started seeing the system sort of automatically putting you into whatever you purchased last year. But we actually encourage people to go do that shopping at the Marketplace, because from year to year, the cost of the plan that you're in might change, and the structure of that plan might change. So last year, maybe your doctor was in network for that plan, but that might actually be a little bit different this year. So we just encourage people, go onto the website, onto healthcare.gov, look and make sure that the plan that you have is still the plan that you want, because there might be better options out there that meet your needs better this year.
So meeting my needs, one of the things that I'm scared about is the cost. What are some of the various costs of having a Marketplace? Aurora, can you give us some examples?
A lot of low to middle income people actually might qualify for a tax credit, and you can think of it kind of like a discount off of your plan. So it can be affordable for those folks, and I would definitely encourage people to go online and put in their income and see what the cost could be. I know for me, when I had an ACA plan, I got it for about the same cost as 2 pair of jeans that I would usually shop for that month. So it was really affordable for me, and I would definitely encourage others to go and take a look as well.
So for 2 pairs of jeans a month, I can get health insurance?
Yes.
That's super exciting. But who's eligible for the Marketplace? Melissa?
Great. So as Aurora mentioned earlier, the Marketplace was created for people who don't have access to insurance through their employer or through a government program like Medicaid or Medicare. So an example of that actually are documented immigrants. A lot of them aren't eligible for Medicaid, but they may be able to go onto the Marketplace and purchase coverage there. Now, I want to address one of the concerns that we're hearing from the community, which is that there are some immigrant families who are scared to go and get health insurance on the Marketplace, but I want to reassure folks that you are eligible for that coverage, and it won't impact your ability to get a visa or a green card in the future. And while there are some changes that people are talking about, nothing's changed yet. And even if those changes go into effect, Marketplace insurance won't impact your ability to get a green card. So you're safe to go get that coverage, and it's important that you do, just like it's important for everyone else.
So we've now talked about the benefits of having health insurance through the marketplace, the cost or potential cost of having a health insurance, and who is eligible. But where can someone go to get enrolled?
Legacy Community Health Services. We are here to provide in-person assistance from Houston, throughout the city of Houston, even in Beaumont and Baytown. We have in-person assisters that will take their time to speak with you about anything regarding healthcare insurance, marketplace insurance. Even if you just have a couple of questions, maybe you started the enrollment process, you're a little insecure about the plan you selected. Before you actually select that plan, we can help you with that process with in-person assistance. Also, there's an organization called Change Happens. They're available to provide in-person assistance if you're in the Houston area. Another way to enroll is online at Healthcare.gov. You can go to the website, create an account, make sure that you remember your password and your login, and start that process. Should you have any trouble or you would like to speak to someone, if you're like me, I really like to talk to people, as you can see. So you can call the marketplace. They have individuals that can do the enrollment via telephone. So remember, there's no wrong door. To go see an in-person assister or to speak with someone over the phone. There's 24/7 assistance at Healthcare.gov through their phone system. They have 150 different languages for you. So regardless of what language that you speak, there should be someone there to provide you that assistance.
Sounds awesome. Is there anything else that we would like to add before we end?
Yeah, so I just want to reiterate that if you want to enroll in the Affordable Care Act or the marketplace this year, go to healthcare.gov. It's really important that you're going to that website specifically. Or if someone's helping you to enroll, whether it's someone through Legacy or someone through the Enroll Gulf Coast Collaborative or your neighbor or your cousin, make sure they're using healthcare.gov. There are some websites this year that are selling insurance that doesn't have to follow the rules of the Affordable Care Act. So it's important that you're using healthcare.gov to make sure that you're purchasing coverage that, for example, will cover your pre-existing condition. So if you have health needs that need to be addressed, if you're going to healthcare.gov, that insurance is going to make sure to cover those conditions. If you're going somewhere else, it might not cover it. So it's really important that you're using healthcare.gov.
If you utilize healthcare.gov, you definitely will have a peace of mind knowing that you're getting a comprehensive healthcare plan.
Perfect.
Awesome. Aurora, do you want to add anything about the Affordable Care Act or marketplace?
No, just that 85% of people who went and shopped last year actually did get a tax credit. So again, I just would encourage people, it might be way more affordable than you think.
Mm-hmm.
The last thing I think that we need to make sure everyone knows is that the deadline for the marketplace is December 15th. So you must enroll before December 15th. Mm-hmm. And if you're looking for somewhere to enroll, you can go again to healthcare.gov. You can go to enrollgulfcoast.com, which also gives you access to Legacy and Change Happens and Houston Area Urban League and other organizations here in Houston that are here to help you enroll into the marketplace. So thank you for all of you for being here. Thank you, Legacy, for having us, and have a great year.